New tonight, schools in one central Texas city are closing because of the flu.
In a letter to parents, the superintendent of McDade ISD in Bastrop County says attendance has dramatically declined. They'll now cancel classes tomorrow and Friday while staff sanitize the schools.
This comes as local doctors are seeing more and more flu cases. At Austin Regional Clinic, the number of positive test results doubled in just 1 week, going from 220 to 431. KXAN's Eugene Cho found out what's causing the increase and how you can stay healthy this flu season.
For me, it just started with a little little tickle in your throat.
When registered nurse Katie Castle helps someone who has the flu, she knows exactly how they feel.
I was one of those flu patients, and it was horrible. I mean, it was a good 7 days where I just felt like completely drained of my energy.
Dr. Christopher Chang says flu cases tend to spike in January.
We think the reason is that after the holidays, lots of people are traveling. They're getting together with families, you're around more kids, and so just exposure goes up.
To be clear, this year's flu season so far isn't as bad as it was last year, but it is far from over.
If you do get the flu, Dr. Chang says keep in mind Tamiflu is effective only in the first 48 hours.
Every year the flu virus changes, and so every time that we're using Tamiflu in a case where somebody really doesn't need it, there's a chance that will increase the risk of resistance from future flu cases.
At this point, Dr. Chang says there's no way to tell when this year's season will reach its peak.
Sometimes that's early, might be in January. Sometimes it's later, might be March, or sometimes even April or May if it's a late season.
So prevention will be key.
I keep hand sanitizer with me everywhere, and I really recommend people do that because you don't realize how many things you touch or how many things other people touch.
Eugene Cho, KXAN News.
Austin's health director tells us data he's getting from other hospitals and medical providers also indicates flu activity is on the rise. He says this is the time to take the precautions and help out others. Cover your coughs, stay home if you're sick, and wash your hands again and again.
So far, this year's flu vaccine appears to be on target. According to the CDC, it has been effective against the season's dominant flu strain. It comes as more studies show the benefits of getting the vaccine. A 2017 study was the first of its kind to show that getting a flu shot can significantly reduce a child's risk of dying from the flu. Two other recent studies show flu shots lower flu-related admissions to the ICU, length of stays in the ICU, and overall hospitalizations. The CDC recommends you get the vaccine to help protect people around you who may be more vulnerable to getting the flu.